Human Services Committee to order at 9 o'clock a.m. on July 22nd. Can the clerk please call the roll?
Legislator Block,
Here.
Burtis,
Here.
Denton,
Here.
Kelly,
Here.
Chair Romeo.
Here. Thank you. First order of business is to approve the minutes from the previous meeting. Are there any objections to the previous minutes? No? Seeing none, the minutes are approved. And with us today, we have Commissioner Amy Cunningham. And if you can introduce yourself and your title, presentation on foster care.
Good morning. Amy Cunningham, the Commissioner of the Department of Children and Family Services here. It's good to see everybody again. So I'm going to talk to you this morning about the very large foster care account that's in the budget. It's a specific account in the budget. It's the only thing when looking at the budget online that points out foster care or child welfare or anything specifically like that. And I'm going to kind of go through it globally, and then I'll get a little granular. And there's no single report that we can pull to tie the finances to the programs, to the kids, to the expenses. So it's kind of my chicken scratch here, just putting it all together. And if anybody needs any follow-up, I can see how I can maybe organize it better. Okay. So if we, first of all, I also want to say, which I think we said before, all of child welfare is regulated by New York State Office of Children and Family Services. So you're going to hear me talk about rates and different categories and stuff, and that's all regulated and stipulated, and the oversight entity is the New York State Office for Children and Family Service. So we don't have discretion in any of these rates and numbers and all that kind of stuff. So our 2026 budget amount in this account was $57 million. And in 2025, we spent $60.5 million. We're forecasted to spend about $64 million this year. That's based on projected rate increases and stuff that we don't really know right now when or if they will come through. About 55% of that is reimbursed by state and federal reimbursement sources, $35 million, and about $28 million of that is local. So within that account, there's no personnel in that account, there's no mileage, supplies, anything like that. It's specifically for the care of the children that are in foster care. When I looked at some numbers recently, the number I was looking at was we had 607 children in foster care. I looked this morning and we have 581 children in foster care. And again, depending on which report you look at, what day it is, the courts children are coming or going when they hit the system. That can always fluctuate, 5 to 10. But in general, over the past 6 to 12 months, we've seen a slight decrease. We have discharged more children to permanency than we have taken into foster care, which is a really good sign, and hopefully that continues. So within those big buckets, we have regular foster boarding homes. So those are foster parents. Those are children go into a home and live with foster parents, with their bio siblings, with other foster siblings. And there are different categories of those types of homes. We have our own DCFS certified foster homes. Not all counties do that on their own. Most of them, a lot of the larger counties do, but most of the smaller counties do just contract with voluntary agencies, and those agencies are the ones that certify and maintain the foster homes. So when a child comes into foster care, we look to our foster homes first. If we don't have an available foster home, we have an array of other agencies that we can call and say, these are the children we have, these are the needs. Do you have a home? And the agencies are the ones that have most of the therapeutic level homes. They have higher training levels. And then we would place a child that way. So those are the different levels of foster homes. And then in addition to that, we have our residential placements, which can be group homes. They can be respite. A child can go from a foster home to a respite group home for a week or 2 weeks. We have the state certifies Empower programs. We only have a few of those in the state, but those are for youth who are sexually trafficked or at risk of becoming sexually trafficked. We have SILP, independent living, that's an supervised independent living program. So that's for our older youth in care who are, their goal is to transition to adulthood on their own. So the supervised independent living helps them to get there, and then we have the QRTP, the Qualified Residential Treatment Programs, which is the institutions that you would hear about, regular residential foster care. So those are kind of the big placements within the budget. In terms of the number of kids, when I looked at the when we had 607, 493 of that 607, those children were in homes. 290 of them were in our foster homes, DCFS foster homes, and the remaining were in voluntary agency homes. That was about 203. And then we had about 114 in some sort of a residential placement. The rate structure for foster homes is broken out by a level as well as age. So the first level is just the regular level of foster care, and that's the only one that's broken out by age. So for 0 to 5-year-olds, a foster parent receives $33.36 per day.
Can you repeat that number?
$33.36. Another thing, and I can send you this too, all of these rates are on OCFS's website. So I can provide you with the website and how to go, all of the foster care rates, all of the voluntary agency rates, everything is on the OCFS website, and they update them regularly. So 0 to 5-year-olds, foster parents receive $33.36 per day, which ends up to be about $12,176 a year to care for a 0 to 5-year-old. For a 6 to 11-year-old, they receive $39.75, which is approximately $14,500 for a year. And for 7 to up to 21-year-olds, it's $40.17, about $14,662. If a child has a higher level of need, has a particular diagnosis, needs closer supervision, there's what's called a special rate, and that requires documentation, either a psychiatric or physician diagnosis, and that special rate is $71.99 a day for a total of $26,276 a year. We take another step from that. We have an exceptional rate, which is, a higher medical need or supervision, or, a situation where a child can't be around other children for certain behaviors, needs one-on-one kind of supervision. And that rate is $109.11 for a total of about $40,000 a year to care for that child. And OCFS recently implemented, I think it was last year, an extraordinary rate. And this rate is $132.76 and just under $50,000 a year. And this is basically a foster parent would not be able to work if they took this type of a child, and they're usually medically fragile, need round-the-clock care. We currently only have one of those rates within our system right now. But it is an opportunity to keep a medically fragile child or something in a home versus a residential program.
The rates have all increased recently.
Yes, they increase every year. Usually, it's been about 6% recently. And if we go back and look at when the budget really started increasing in foster care, there was a class action lawsuit against OCFS saying that the rates were not sufficient to caring for children. So there was a pretty substantial bump in the rates, maybe 3 to 4 years ago. Also, due to that class action lawsuit, there were some counties that didn't pay the full rate to the foster parents. They did an income-based structure. So they would take the foster parents' income into consideration when providing rates for caring for children. And Onondaga County has never done that. Onondaga County has always paid the maximum state aid rate. We think it's an important value add to our children to have the foster parents caring for them. So we, as long as I've been around, had always been paying the maximum state aid. So a lot of counties saw an even larger increase in their foster care budget because they weren't paying. They went from not paying the 100% to having to pay the 100%, and then an additional big jump on that. So yeah.
Is there data not only from Onondaga County but statewide in terms of these rate increases having the desired effect, whether that's increasing total volume of placements available?
Yeah, yes and no. It's not great data. It's kind of showing, statewide, it's a struggle that we're seeing reduced numbers of foster parents. Yeah.
are we able to meet the existing need? I mean, how do we capture that, pool of available children versus how many places we have available?
Yes, so we, can I finish the,
Yeah, please.
I'm going to get into that. Yeah.
I do have a question about the rates. That 6% growth
Yep.
that you were talking about, is there a built-in growth going forward,
Yes.
or is that
Yes, there's
Okay.
always built-in growth.
what? How do they measure that?
I think it's 6%.
It's just a flat 6%.
I believe so. I think that's how they budget it. It's not always 6%, but we don't know what it's going to be. The state
Yeah.
provides the increases, yeah.
Yeah, but is it like, some increases are just based on how they're feeling about the budget that year, but others are based on like CPI or inflation or
How the state increases them?
how the rate is
Rate is
going to be
just-
increasing going
yes.
forward. Yeah.
Usually tied to cost of living and cost of services and stuff. Yep.
Okay, but that's built in now, so that
Yes.
okay,
Yep.
$33.
So, the total of that 64 million that is for children who are in foster homes, either DCFS foster homes or voluntary agency foster homes, is 32.5 million. So that's the money going to the foster parents directly for housing, food, clothing, those type, just general care of the child. When we look at residential placements, we have about 114 children and youth in different levels of residential care. And of that 64 million, about 20 million is going to this residential care for 114 children or youth. So you can see that that is substantially costing more than the foster homes.
What was that number? 20.
20 million. Also in this budget line are what's called CSE placements from the schools, the Committee on Special Education. So if a school and the CSE committee finds that they are unable to meet the child's needs in the classroom, in the school, based on education law, they will then refer them to a school placement, whether it's an OPWDD placement, OMH placement. I'm not familiar with all the specific education placements that are available, but the county pays for 50% of those placements. We have zero management. They're not on our caseload. They're not on foster care. It's simply a transaction where the counties are responsible for paying for 50% of those costs. In the 2025-26 school year, we had 15 of those placements, I believe. The previous year, we had 22. We're looking at about $4 million in the current year, 2026, for those expenses. That fluctuates anywhere between $3.5 to $6 million because these programs have 5 years to bill. So we might get no bills, and then we get a bunch of bills, and we could have 15. We could have a low number of kids and a $6 million bill that year because schools are billing retro.
So you had talked about how that they don't have to be in foster care
No.
or anything, so it's just every child in our county.
Yes.
Does that include CPSE as well, Committee on Preschool Special Education?
No.
No, so it's just CSE.
Yes.
If I could, just back to foster care. I appreciate being focused on the numbers as far as how much we pay, but is that, I don't believe, tell me if I'm wrong, please, that's the main driver as far as you're not paying me enough to do it, so I'm not going to do it.
No.
Right, yeah.
No, absolutely not.
Right.
And we, could talk, so many things we could talk about in terms of foster care, but the data I have today is to explain the numbers. What's driving the numbers, and then very happy to discuss beyond that as well. It is a very large, confusing account. But yes, absolutely. We have great foster parents that are doing it for the right reasons, and they want to help, and they do extra above and beyond
Yes.
that they're not. Sure. Is that better?
Sure.
Okay. So beyond CSE placements, we have the adoption subsidy and the kin gap subsidies, which are also in the foster care account in that $64 million. And So when a child comes into foster care and the parental rights are terminated or surrendered, our goal is always reunification. We work very hard to the kids are most successful when they're at home. But when we do have situations where we have to go to court and terminate parental rights, or there's a kin relationship, guardianship, that foster care rate continues until the youth is 18 or 21. So we continue to pay those subsidies to those families. So the adoption subsidy this year is projected to cost about $15 million. So $15 million of that is going to families that have adopted children and youth that we are no longer managing the cases. Always available here. I know there's connections and relationships, and adoptive parents continue to foster, so it's an ongoing relationship, but there's no case management over those adopted. They're fully permanent. They're part of that family. Same thing for kin gap. Kin gap is another way to attain permanency without terminating a parental rights. If a kin or fictive kin, a relative or a close family friend takes on the care of a child and wants to maintain a relationship with the parents of origin, we don't have to terminate the parental rights. They can still be involved. But the kin relative takes on full guardianship and management of that familial relationship. So they, can decide visitation and that type of stuff, but they also have full medical, educational, decision-making rights. And that is about $5.3 million.
In addition to the 15?
Yes. So just over $20 million to support ongoing permanent placements, adoptive and kin. And the last bit we call the miscellaneous. It's just under $6 million. So this is the account that captures everything else that it costs to raise a child: summer camps, school, extra school clothes, prom dresses, birthday gifts, Christmas gifts, sports, special equipment, medical equipment, hearing aids, that type of stuff. Any after-school activities, driver's ed, religious or cultural items. Any bedding, transportation, and lodging for family or parents if we need to do visitation. If we're looking at a relative out of state, we might help them to get here and stay here in hotels and flights. So all of those expenses fall into that account. Sometimes we pay voluntary agencies for one-on-ones if there's a child in a residential that really needs extra support, and in order to not disrupt that placement, they will need a one-on-one for a certain amount of the day. So we'll do an extra contract for that. So that just under $6 million accounts for all of those miscellaneous expenses for families. Anything extra, the rate is housing, food, everyday clothing, but anything extra that needs to be paid for the child comes out of that account. Summer camps, hair care, to make sure they have normative experiences within the foster home.
How are those determined to be paid out? Like, do foster parents apply for them, or is there criteria? We'll give you this, and that. How does that work?
There's criteria for some, like the summer camps have a set. It's $400 a camp. There's a chart with certain things like that, but it's mostly just the caseworker working with the family and identifying the child's needs, and then they will fill out a request, and it'll go get paid off the case, so to speak. So yeah, it's mostly a request form. We do have a chart with some identified expenses, but we don't. It's not so narrow that if something that we've never heard has come up before, it would be a no. So there's just an approval process.
Okay.
Could you expand on case management with regards to things like medical care, mental health services, or prevention, things like that?
Yeah, so in terms of medical care, we have a very unique partnership with Enhance over at Upstate with Dr. Blatt, and that's our foster care clinic. It is the only clinic in the state, possibly one of few in the country, that functions in partnership with Child Protective Services and Child Welfare, and that all of our foster children go to Enhance. It's right over in the new Nappy building. It's beautiful. And Dr. Blatt's been doing it since, I think, the 90s, early 90s. And there's a psychologist on staff. They have access to all sorts of mental health resources, behavioral health resources, referrals from that office. We do have foster parents that get frustrated a little bit that it takes too much time to bring the foster children there because they are so thorough and they spend, as much time as needed. The initial visit can be up to 2 hours at times to really, work with these children and the foster parents, and they encourage the parents of origin to be there as well. So that, that's our medical partner, and there are very specific medical care guidelines from OCFS, and I'm going to send you the website. That one of the manuals is the healthcare manual. It's pages and pages and pages, and if we didn't have Enhance, our case workers would have to manage that and have to ensure that the children in foster care were meeting all of those, the initial screen and every single thing that is required, which is more than just a general pediatric visit, and would have to do it for multiple different pediatricians in different offices. But because we have this relationship with Enhance, that is kind of taken off their plate. They have to ensure that the child is going and being seen, but they don't. Enhance is the one that knows all the regulations. They know what needs to be done, and they do all the follow-up as well. We also have the partnership with McMahon Ryan Child Advocacy Center. We have a CPS, an investigations unit over there, not a foster care unit, but all of those services, counseling services, mental health services, advocacy services are available to our children in foster care. Because mental health is also part of our department, when we do have a child or youth with higher needs or specific mental health needs, then we can collaborate. Our child welfare team and our mental health team can collaborate and do, multidisciplinary meetings and wraparound services. So that's very helpful, having everybody in the same department at the same table. When a child is placed in a voluntary agency foster home, the caseworker has a little bit less of a role because there's a case manager within the voluntary agency, and the agencies will have their own integrated services and supports. So just a little bit of process. When a child is in a voluntary agency home, our caseworkers are responsible for seeing them quarterly, whereas if it's one of our homes, it's monthly, because they're having the ongoing contact with the voluntary agency home, and they're the ones that are managing the case and doing the referrals and making sure they're have the mental health and that type of stuff.
And all under the OCFS umbrella, correct?
The mental health, yes. The voluntary agencies is OCFS, yes. So their certification would include, they often have a nurse or a nurse practitioner on staff as well within their OCFS certification, yes.
Elaine, I know you had a question. Is it related? I just wanted to stay on this topic. If
Oh, no, go ahead.
No? Okay, sorry. Questions on this topic? Because I have a couple of questions on this topic. You had talked about how people express frustration about the delay in Enhance. Do you know what kind of delay it is to get children in there?
It's not a delay. It's usually, it takes a long time. So if they're
Oh,
working,
once you're there,
yeah.
Okay.
It's not
Is there
necessarily
any delay
delay,
in
but-
getting
No.
children in there?
No.
Okay.
We get them in within 24 hours usually,
Okay.
within a business day yep.
And if there's ongoing healthcare needs, they have to go there as well? Then? Okay. And with the mental health piece, is there any kind of requirement for foster families to get children mental health, or like if that child has been getting mental health needs, do we say you have to continue those, or do we say?
Yes, we would continue whatever they're. If they were currently working with the therapist and that made sense, yes, we would continue. They do, as part of the intake at Enhance, meet with the psychologist there to kind of go through all that, the current medical mental health needs and the ongoing plan. Yeah.
Given the situation that they're in, where they've just been put into foster care, wouldn't we assume that all children that are in that situation would need it and get it for them?
Yeah, it is traumatic just to be in foster care. Yeah, but that's why they work closely with Dr. Zlansky at Enhance to kind of identify what level of
level.
need and support. And he's always there too to see the kids as they come in. So yeah.
Okay. And with Enhance, if the child has a medical, let's say they're sending the child to Enhance, and they say, hey, you know, I have this other thing that I just want to send them somewhere else. Can they send them somewhere else
Oh, yeah.
as long as they're still meeting those check
Absolutely.
boxes that you're
Yes.
talking about?
Many of
Enhance?
them go to see specialists. Yes.
Okay,
So
yeah.
It's part of the upstate continuum of care. So
Okay.
they will refer them to whatever is necessary.
Any other questions, mental health, medical related? Okay. Elaine, go ahead. I know you had a question.
So you mentioned summer camp. I was curious about daycare, if that's available and how
Yes.
that's covered.
Yes. So daycare is available to all foster parents as part of the daycare child care block grant in DSS. It's been a little tricky with the wait list, but we have been able to continue to fund all foster parents that need daycare. Yes.
So it's
absolutely.
funded separately from like the $33.
Yeah, that's separate. That's not in there. Yeah, babysitting, like one-off babysitting would come out of there, but not the general daycare. Yep.
Are there any restrictions on that? Like if you're a stay-at-home mom of 5 kids, you know, you have one of them is a foster child, are we able to provide daycare for
They
that?
still need to fall into the child care block grant.
So it's whatever
Work,
qualifies them
yes.
for that black grant, we don't.
Yeah,
Okay.
they would have to be employed. Yep.
Okay. Does self-employed count as employed? Yeah. Okay.
I know that both the administration and this body have recognized foster care as a major priority. Daycare is one thing that we've been able to really invest in to make sure that we support people willing to help these kids out. And I know there's been examples with lead remediation as well. Could you speak to that and any other programs in place to support kind of the foster care infrastructure throughout the county?
Yeah, so we have partnered and have a pot of money for the lead infrastructure. So part of, and when I get into the foster parent recruitment, it is a lead assessment of the home. And if a foster parent has a home that has lead in it, then we have a pot of money that can fast track them to get that remediated. Okay, so I can talk about the process for becoming a foster parent. So as I mentioned, there are DCFS foster homes and then there are voluntary agencies. So I'm going to speak mostly to the DCFS process because there's tons and tons of agencies, and we contract with any and all of them. Those contracts all have a $3 million cap on them, which we don't usually meet. But anytime a new voluntary agency is certified, anytime we find a new placement, either in-state or out-of-state, for a child or youth that with an entity we haven't worked with, we will contract with them. So it's an ebb and flow of who we have contracts with. Right now, I believe we have about 30 of them.
What's the benefit of contracting opposed to hiring our own?
The voluntary agencies have the residential placements as well. So, and it's a volume situation too. And a lot of the voluntary agencies have the therapeutic or specialized foster homes, more of them. So we have 243 certified foster homes. And then we use the voluntary agencies as a supplement to those.
Yeah. Because we use so many voluntary agencies, are we working on building our own capacity so that we wouldn't have to contract, or is that your model?
Not
with the contract?
necessarily. No, not necessarily. They kind of meet two different needs. Our foster homes are often the regular rate children that, the children that come in that don't have maybe a higher level of need. We have a pool of foster homes that we work with regularly, and then the voluntary agencies can tend to be a bit more specialized and have the therapeutic homes and the higher levels of care that we don't have the infrastructure right now to do that in-house.
Yeah, but we're not trying to get to that point,
No.
right? Okay.
No. It's actually a cost savings to have the voluntary agencies do it.
Yeah.
And is efficient and more successful, I think. Yep. Yeah, so there's a website on fostercare.org. We contract with Hillside for all of our foster care recruitment and initial certification activities. So their recruitment, they do tabling at events, they do recruitment events, they go to family school events, stuff like that. They're out in the community. They hand out flyers. They have a Facebook account, are exploring other social media accounts to recruit. They regularly, speak with current foster parents to engage to see if they have other referrals that they would like to make, other families to refer. So it's an ongoing engagement conversation with the folks on the ground recruiting. So what initially happens is if an individual or family is interested in fostering, they will call the number on the website, call Hillside, get in touch with, they can call our offices, we can get them in touch with Hillside. And the website has a decent overview of the initial general steps. So once they have a conversation and they think it's something that they, want to explore, at least they will receive the application either online or there's a paper application. That application includes a self-assessment. There are some clearances they need to go through, the staff exclusion list, which is through the Justice Center at the state, which is anybody who has worked in a residential setting or with vulnerable populations who has been reported for abuse or neglect within the employment capacity and is on the staff exclusion list. So we check that, and then we check the state central register as well, the child abuse and neglect, to see if there's any history with that. They have to have a medical exam, a physical. They have to show proof of a driver's license. They have to show proof of vaccines if they have pets for rabies and stuff like that. They have to show some income verification, and then the lead inspection is part of that process as well. So they go through all those steps, and if they meet the initial criteria, then they can start engaging in the training or the group conversations to move forward. The training is a 10-week session. It's in person, various locations. It changes now and then. To receive that initial certification, and then once a parent or family is a foster family, there's ongoing supports. There's support groups. There's additional training opportunities if they would like. There's activities for families and stuff like that through, Hillside coordinates all of that. Once they are certified, they come into our home finding unit within child welfare. So it's a unit of 4 to 5 caseworkers and a supervisor that work regularly with the foster parents. They don't have a caseload of children in foster care investigations. They have caseloads of foster parents. So they're the resource in-house for the foster parents. For kinship placements or relative foster care, the first thing we always do when a child comes into foster care is try to find a relative that is willing to support the child and the family, because it's proven that kids' outcomes are better when kids remain with families. And there's a fast track to becoming a certified foster parent for relatives. We can do an initial foster parent certification within a day or two, and then they have 12 months to complete all of the trainings. Hillside also has specialized trainings, and they'll do one-on-one support too with kin, because it's often a different structure. It's a different relationship that you're working with than a general foster parent. So they do that as well. As I said, they do events, tabling. They do an event at the Crunch game every year. They're at the Mets game. They have flyers, handouts, canvassing. We talked about that. They particularly are always trying to recruit families and foster parents that will take teens, sibling groups, or children, youth that might be medically fragile. I did forget to mention with the rates too, we have an incentive here in Onondaga County that if a foster parent will take a sibling group of 3 or more, they all receive the special $71.99 rate. regardless of the needs of the child, as an incentive to keep sibling groups together, because it can be challenging and maybe a little scary to take on 3 to 4 to 5 children at once. So we just want to, show that we're there to support them from the very beginning. And that has helped, I believe, over the years, keeping sibling groups together.
I have a quick question on Hillside.
Yep.
So you had talked about contracting with the other homes for capacity and specialty purposes. What about Hillside? That sounds like stuff that we do normally, right?
So Hillside is, we have 2 of them, because this actual recruitment, foster home recruitment and initial certification is a separate contract. It's not in the foster care line. It's $414,000. So that pays for all the Hillside employees, all the events, all the stuff, the trainings. And then Hillside also is a voluntary agency.
Yeah.
So they have their own certified therapeutic foster homes. And another thing I forgot to mention with the voluntary agencies is that when a child is placed with a voluntary agency, the family they're placed with receives those daily rates that I discussed, but the agency also receives an administrative rate. And those rates vary, depend on what the state approves. It can be, as low as $30 if it is a day, just if it's a regular foster home. If it's a therapeutic, it might be $70 a day, because there's more services involved. There are more people on staff at the agency that are working with the families, skill builders, that type of stuff. So those rates vary. So that cost is then reduced within our staff, because they're not managing the case as intensely as with one of our DCFS, because there's the case manager on the voluntary agency side. So there's the higher cost and then the reduced workload on our side.
Yep. So we're paying. It's like a double rate, because the rate goes to the foster parent and for
And
the
the admin,
entity.
yep.
I forgot what I was going to say. Oh, so Hillside is the with the promotional piece and recruiting piece. We don't think that we could do that better? I don't know how to word that. Sorry if that's worded weird.
Really, that's not the core skill set that, our child welfare caseworkers are receiving. Like I said, we do have a unit that specializes in that. But really, I think to focus on the actual child welfare process and placements and the court appearances and the, working toward permanency, making sure the family has all their needs, that is kind of a side entity that is cost effective, and they do it better. Yes.
And you had talked about how in that they communicate with current foster parents to get feedback in the communication piece.
Yep.
How do we then get that communication from foster parents? And do they send it to us, or do we have our own processes?
So the home finders are meeting with them regularly to talk about the families as well as any challenges or anything, and then they bring it back. And there's a supervisor, and then it's also administration. They have all of our contact information. We do get calls regularly from foster parents with questions, or they want to talk through a situation, and then we have what's called concern meetings from time to time with foster parents if an issue has come up, and we get everybody around the table and kind of talk through them and take recommendations for improvements. And yep.
Given the situation where we need more foster families, have we reached out aside from Hillside to ask foster parents, like, hey, you guys have been in it, what could we do to have you tell your friends to come? That kind of thing?
It's an informal, yes, ongoing. I think anybody who works in child welfare is always talking about it.
Okay.
Yeah. At the weekend barbecues and stuff, like, hey,
Yeah.
have an extra bedroom? Yeah.
Yeah. Okay.
Yes.
Can I ask a question? So kind of speaking around that, as far as the home finders, could you speak a little bit more about that role and do they have, you said like family caseload, like what does a caseload look like? And
so we had 243 certified foster homes, and we have, I believe, 4 home finders in the unit. So those are split up between 4 to 5 caseworkers. And they need to do recertifications regularly. They need to stay up on their trainings. So that home finder is assigned to, a handful of families that they're tracking their recertifications. They're making sure they have all their trainings. They're identifying any additional needs. If there's a family unit change, everything has to be documented in the system. So that's what they're doing. They're working regularly with a much larger caseload of foster families than a child welfare caseworker would have of children.
And that was one of the questions I had actually, but it sounds like there is a recertification process
Yes.
for the foster parents as
Yes.
well? Okay.
Yes. Ongoing. Yep.
So if I could, of the 243, I call them special people, really, could you give me an idea of, is that a good number? Or the past, looking back and then looking forward, right? So in the past, was it higher, lower than 243? And then in the future, what do we think that's going to be? Any ideas about that?
Yes. So it's not a great number. We always want to see that number
Right.
going up. It's hard to say whether or not it has been higher in the past because in recent years, we've really pushed the kinship and the kin certification. So that has increased the number. So a relative can take custody of a child without being a certified foster parent, and they wouldn't show up in these numbers. They would receive cash assistance from DSS for that placement, which is not as much as the foster care rate, which is why we, put in, it culturally kind of shifted around 2018 to 2020 about, we really want to keep children with families versus in the past there might be a thought that it's better to pull the child completely away from even the extended family because it's all part of the mix. But research has shown that that's not at all ideal for positive outcomes for the child. So really, as that culture shift happened, we saw the numbers of certified foster parents go up. But that was because of the certified kin that normally would not have been certified. So no, not a great number. We would like it to be higher. There is a new federal legislation that is called One Family, One Child, One Family, something like that. That is encouraging, and I don't know what it's going to look like in terms of the state, because the state has to report to the federal agency what they're doing. But that is the push, is to increase the number of foster homes available across the country for children.
Great.
How?
What's the typical, turnover? I mean, what are we looking for? Is it this percentage
Yeah.
of kids get adopted, this percentage of kids age out? How does that process
So as of right now, we have 76 kids with the goal of adoption out of the 581 in care that are on the books just today. So that's about 13%. Not all foster parents who adopt stop taking foster. Some continue, some do stop. So there's that general turnover. Some foster parents age out too of foster parenting. So I'd say about, we have been averaging bringing in about 20 families a year, like 15 to 20 new families a year. And maybe, it's similar number that are coming off the books as well. The numbers, I forget, aging out was, I can't remember what that number was. It was under 30.
And those 76 kids that you referenced, are those in-house, like within the foster unit, or are those outside adoptions?
Those are in foster. Those are children in foster care who we have gone through the court process to terminate parental rights, and their goal for permanency is adoption. And most of them are with pre-adoptive families, and it's the general court process of getting them across the line. So I mentioned that there's a lot of good information on the OCF website. As I said, all of the rates are on there. All of the voluntary agency admin rates are posted on there. They change fairly frequently, and they send us spreadsheet emails every time they're updated. There's also, and I can send you the links, several guides and manuals on the OCFS website. The Child Protective Services Manual is very informative. It actually explains the different eligibility criteria for the different levels of rates. It describes what foster parents are responsible for and what we're responsible for in terms of overseeing. This health services guide I was talking about is on there too, that really big guide that our enhanced folks take care of. There's an adoption services guide, a kin gap guide, a home finding guide, a foster parent guide. There's all sorts of information on there that is helpful to kind of, I know this is a lot of numbers and a lot of information that's being pulled from a bunch of different resources, but I can certainly share those links with you.
To follow up on Legislator Burns' question about, and then you had answered about kinship and going back to the family, how is that decision made of it's best for the child to go back to the family, given the complexity of what going back to the family might mean? Who's involved in that, or who does the foster parent get to be a part of that discussion in terms of what they've been seeing?
With kinship or with just general foster care placements?
With the kinship, with any piece that is returning to the family, is it going to the parent, going to a relative? You know, I know there's a lot of different paths to go down there, but.
Yep, so there's, all the case management and casework that happens, and ultimately it's the judge that decides everything in these cases. So the recommendations are made when parents' rights have not been terminated. They need to meet the minimal level of care to basically have their child, which is pretty low for most people's standards. So, yeah. So there's all the information is gathered. There's ongoing permanency hearings every 6 months where the caseworker is gathering all sorts of information about the parents, what they've done, the services they've done. They get collateral contacts from all the service providers the parents are working with, all the collaterals for the child, the mental health, the physical health, the school, how the child's doing, input from the foster parents, and then everything is summarized in reports and presented to the judge.
Okay. And you had brought up the courts making that decision, and ultimately, how is the foster parent involved in the court process? Are they completely hands-off, or do they?
So after a child has been with a foster parent for a year, they have what's called standing. So they are able to speak, to have a voice, to be involved in the decision-making, to present their views.
Okay.
I know that was a major issue through the pandemic, was just the volume of cases and getting them through family court. Has that largely normalized since then? Are we able to proceed with the cases that we have?
Yeah, there's still backlogs in certain areas due to whether it's staffing, the termination of parental rights petitions are the kind of like the last thing left that we're working through very diligently. We have a great group of almost fully staffed attorneys now, and they're just working really hard with the judges to move things along.
With that, is that that termination of parental rights situation right there, is that when a child is removed from a home and then it's attempted to terminate the rights?
Parents have 15 to 22 months to show that they're making improvements. And then that's the timeline that we're technically required to petition to terminate parental rights if there's been no movement. There are other situations. There are severe abuse cases that you don't need to wait the 15 to 20. There's abandonment cases where you don't need to wait, but most of them are 15 to 22 months. And we're going on a couple years of a child in care when we move down that path.
Okay, so let's say like the 14-month period, we could remove a child from the home, and then 14 months later, just say, remove a child from home, put them in foster care, and then 14 months later, just say, they're just going back? How does that?
No, again, that would be the judge. So based on, the parents have the services that they're court ordered to do, if they're engaging in services regularly, if they're engaging in visitation regularly, if they're making progress, you go back for the 6-month permanency hearing and the 12-month permanency hearing, and then, at 12 months, say the caseworker's like, yeah, the family's doing really well, they're completing all their services, they've been successful, they're bonding during visitation, then we could make a recommendation to return and the judge could return. We could not make a recommendation to return based on different circumstances and the judge could still return. We have an opportunity to return a child home on what's called a 10-day notice, and if it's outside the term, if it's, you had a permanency hearing, and it's 2 to 3 months later, and you don't have another one for 3 months, but you think the family's ready, you can send what's called a 10-day notice to all parties, attorneys, judges, and say if anybody objects to this, then they'll call a court appearance. If not, if everybody's good with it, then we return the child.
Got it.
It's all based on the service timeline and the progression of the case. Every case is different.
Go ahead.
Okay, so just to sign up for a foster parent and supporting that decision, I know you mentioned the respite.
Respite?
Yeah.
Mhm.
I was wondering if you can go more into detail of like what that is and kind of what that entails.
Yeah, so there are foster parents that do specifically respite. So if it's something, even like a foster parent has a business work trip or has a long weekend planned or something, then the foster child can go to a respite, what's called a respite foster home, while that foster parent is away. Or if it's a child that is that needs one-to-one supervision regularly, and it's a situation that is kind of exhausting, so to speak, then the foster parent would need a break. The child could go to a respite for a few days, for a week, or something like that. So it's flexible in the needs of the foster parents, whether it's something planned, they're going to be out of town, or whether it's just you need a break for a few days.
And is there any like if they're using that a lot, is that a concern or?
Yeah, I think there is only a certain number of days they can use it. Yeah. But that's definitely would be something we would pay attention to.
Okay.
If
Thank you.
Question: what are our current resources for respite in the community as far as?
So we do have the foster home respite, and we have we work with Elmcrest, the mental health respite. Hutchins has a respite. The different programs that we can use outside of the OCFS system, the OMH, and OPWD has some respite, so we use those services as well.
When you say foster care respite, what is that?
Like certified foster parents who provide respite.
Okay, so we send foster kids to other foster
Yes.
parents who are
Yes.
okay. My question is, with post 2020 and us trying to figure it all out with caseworkers and courts and everything else that's going on in terms of delaying, and like you had mentioned, the court system might be, okay, wait another 3 months. In terms of timeline, especially because when we're talking about a kid like younger than 5, months can be a big deal. Is there anyone that is allowed to have kind of a check on the system? Like, can we somehow hold the courts accountable, or can parents hold us accountable, or can we, there seems to be a lot of delay in things everybody's trying to figure out. Like, who has or is there any way to put some kind of?
It's definitely recognized at the state level as well. I was just at a commissioners meeting on Monday with the state commissioners, and the OCFS team has actually pulled in OCA, the Office of Court Administration, to start. There's always been a work group on the hard-to-place youth and individuals, and the kids getting stuck in hospitals and hotels, which we have not had a kid in a hotel in over a year. And we intend to keep it that way. So that is a missing piece in terms of this coordination together. I know the court's always working on their own stuff too, but at the state level, bringing them together to help solve the issue, not only of lack of residential programs, but how do we improve the court system with the current resources in the community to move along faster. Yes, but it is still a volume issue as well. Just getting the cases through the court system,
Yeah.
through the judges, and they're booked pretty heavily. Our attorneys are not sitting in their offices doing paperwork ever. They're always in court. So it's definitely being looked at, being worked on. And, you know, the attorneys are the ones, too, that can move things and file motions. And
I just, for like a kid under 5 to lose
Yeah.
a year or months even, it's just wild, like unacceptable. Any other questions? All right, I have a couple like fast round stuff, I guess I'll call it. We had heard about the car seat safety thing.
oh, yeah.
Is that addressed? We're
Yes.
good?
Yes, we have ongoing trainings. I think I just saw an email yesterday about another one being offered, now requiring caseworkers to be trained in car seats and providing that to our voluntary agencies as well. That was something that was really helpful that was brought up at the public hearing.
Great. I had heard if we were to send a child to a foster family, getting the things that they might need, like clothing, how do they get that? Where can they get that?
So when initial placements, they'll receive vouchers for clothing and food initially, and then that becomes part of their daily rate after, unless it's something special, like if it's a prom dress or something, a school uniform that they're going to a specific school that they need. But ongoing clothing is part of the daily rate.
That initial funding voucher, what does that look like? How does that get paid
It's
out?
a paper voucher that they take to, I think, Burlington. I know they've been working on some other stores, but it's a paper voucher that we have a relationship with the store,
Okay.
and they can spend. And we have that with Wegmans as well.
Okay, so it's Wegmans in Burlington. How did we
There might be. There's probably
come
more.
up with those?
I don't know.
Yeah.
It's been historic. We've tried, I know, over the years to do Target or Kohl's, I believe, and just trying to work through the steps on the financial side, and we have not been able to come up with a solution.
Financial side from our side or from like Target side?
From both. I mean, what they're, like, they don't want to take the paper vouchers. I believe they wanted credit cards, and we can't have one credit card and share it, and it's been challenging. I don't know the specific, I don't remember the specific
Yeah.
challenges, but I do know it's been challenging. So we do have, we also have some just general Visa gift cards that if a foster parent, if, you know, they say there's absolutely nothing at Burlington that this child can wear, or they need something specific, like a prom, I keep using the example of prom dress, then they can go anywhere that is most appropriate for that child. Yep.
Oh, and then this was just a thing that was brought up. What about the parents or family of the child? Information that they may know or have or be accessible to them about the foster family. I think about like a safety thing because I heard that travel, they needed to give specific location to the family about where they
Oh,
were
yeah.
traveling.
If a foster parent, if a foster child travels, yes, they need to, I don't think it's specific addresses, but just where they're going. And we have the parents sign off first.
Yeah. Oh, yeah. I mean, if
On
they travel, they have to
travel.
sign off.
Yeah.
The concern was that if a specific address was given, because I assume that addresses aren't giving, or any super
Right,
personal
yeah.
information before that, it was just the travel was thought to be like a glitch
Yeah.
in that. All right. That's all I have. Good?
Good.
Good? 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 There's no other? Good? All right. Thank you for your time.
Thank
We
you.
appreciate you.
You too.
The next item on our agenda is from Chairwoman Watts.
Hello, hello. All right, so I am joining each of our committee meetings this week to talk about ADA accessibility. A few months ago, you remember the clerk speaking to the new ADA standards in regards to our meetings and accessibility to the minutes and the agendas, presentations, etc. And this has led us back to a larger conversation about general accessibility, both at the legislature and the county in general. And as we've been reviewing the outside boards and commissions, we noted that in 1999 there was a what was called the Council for the Disabled that went defunct and has not been active since then. And yet there's still a whole lot of opportunity and need for us to have such a council in existence. And so we are looking to re-energize it by a new name, informed by the nomenclature of today, as well as the multitude of lessons and learning and knowledge that have been gained over 20 years since it was last active, to serve as somewhat of an advisory council to our county in not only enacting these ADA standards that are being put down by the state, but in our general ADA compliance period, but also just overall accessibility at the county. So I'm coming to each of the program committees as we're developing. We're looking to relaunch this committee in next session, but wanted to come to the program committees just to put out there, kind of how you think that this might operate in particular, like if there's particular people we should have on there, not necessarily names, but perspectives to make this successful. So for Health and Human Services, is there anything we should be bearing in mind in regards to building this committee, who sits on it, and what its role needs to include in that resolution to set it up?
I'm thrilled that we're doing it. I think that it's huge. I think that diversifying what the things that they're trying to address. So facilities person, if we're trying to address the facilities standards that are needed to address that, but also like training, workforce development piece is going to be very much a cultural, how do we overcome the barrier and the gap that's there, so having that. So I think that it would depend on what the goals of the committee are and making sure that there's somebody that can help on both ends of it. Obviously, I think that someone from the ADA community, I don't know what you call that, should be there to give that perspective, but also, like I said, if there's somebody from facilities or whatever that task that they're going to go down that path.
Yeah, I would start at goals. What's the function? How many people? And of course, trying to find the right people that would hit those goals, and also put together a timeline of it's all about expectations, right? Try to give yourself some expectations, and I'd like this to be done by such and such a time. But when you're developing something new, right, just to try to outline it, I think that's what you're trying to do, which is good. And then, try to create some expectations of, and if we have it together by then, and then we would meet when. I think it's a very deep subject, actually, as let's say Romeo just said, right? So there'd be a health piece, there'd be a facility piece, there'd be all kinds of bits and pieces of it. So yeah, I would work on the expectation part at the beginning before I would dare to say, who, besides the obvious of who should be engaged, asked. That's the other thing. We might have lots of ideas, but who's willing is what it always comes down to, my opinion.
I know several of you have already gotten to speak on this in other committees, so are there any other? As I mentioned before, if you have further ideas or you have suggestions on actual individuals that you think could be a good fit, if you can send them my way. We're looking to establish this committee in session in August, and then to appoint people to it the following month to get it up and running. As Legislator Kelly pointed out, this is the anniversary of ADA this month, and so it's an apropos time to
that number up yet?
be doing.
I shouldn't have forgotten since last night.
I know. I can't say that I did, but I know that you're right. I'm not sure how many years. Was it
1990, so 36 years.
36 years? I know, right? So, but important nonetheless. So, great. Thank you.
Thank you. Does anyone have anything else before I ask to close the meeting?
Can I make one comment,
Sure.
if possible?
Yep. Oh, can you introduce yourself?
Ann
Your
Rooney,
title?
Deputy County Executive. I sit in a lot of your meetings. It's impossible to hear for the audience. And I really, like when we sat in there, everybody could hear because you're having a discussion. And for those sitting out here, it would be more valuable if I sat in my office and watched it on YouTube. Because we, even with all the best intentions, it's impossible to hear because of the acoustics. So I just wanted to go on the record as saying that. I don't know if the other committees experience it, but every time I sit here, I'm like, can you hear? And it's really, really difficult. So just wanted to be on record as saying that. Thanks.
Thank you. Sounds like the first thing the ADA committee can work on. Sorry for that experience. Yeah.
I can't hear you, Dan.
But I do.
We are working on that. There's a significant sound system challenge. We haven't replaced our sound system for 20 years, I believe it is. It's been quite some time, and in the world of technology, that's quite old. So we are actively working on temporary solutions, but also long-term solutions.
Is it possible to go back where there's not that many people, there's plenty of seating to sit around the table where we could all hear and it was never an issue?
I'll talk to Chairwoman about what we do going forward.
Thanks.
Anyone else? I'll end with a comment that Legislator Burtis talks about is just how wonderful foster families are for taking in children and just the burden that is, but the joy that they get out of it and their willingness and ability to do it is fantastic and helpful for everybody. So, just a shout out and a thank you to them. But can I get a motion to adjourn the meeting? Legislator Denton, second. Legislator Black, all in favor? Aye. Thank you very much for coming today. Meeting's adjourned.